There are many nerves in the feet and potentially injuries and inflammation and problems with the nerves. But one of the most common things we see is something called a neuroma. So if you see here in this picture, the yellow areas are the nerves, and they'll run between these metatarsal bones and split to a Y shape and give the sensation on either side of the small toes. Oftentimes, these metatarsals will pinch that nerve right at the area where it bifurcates or splits into two, and that leads to inflammation around the nerve and thickening. There could be swelling around the nerve, which is a neuroma, or a thickening of the tissue. So in a case of an acute neuroma where there's swelling around the nerve, one very effective treatment is cortisone into that area. It reduces the inflammation and the swelling around the nerve, stopping the pinching of the nerve, sharp stabbing pain, electrical sensation shooting into the toes. People tend to feel this more in a shoe because the shoe is pinching those metatarsal heads together, pinching the nerve. If it's a higher heel shoe, these nerves are actually close to the bottom of the foot. So you'll feel that as you're walking in a high heel or stepping down a step, down a curb, up on your toes, squatting, things of that nature will aggravate this. So we want to change the shoe gear, get wider shoes. We often use arch supports again because those metatarsals, if they're moving too much flexibility, they're pinching on that nerve. We'll use something called a metatarsal cookie pad to go underneath those metatarsal heads to lift them up, separate them so they're not pinching on the nerves. Again, the cortisone is very helpful for an acute neuroma, sometimes anti-inflammatories as well. When it becomes chronic, when the tissue around the nerve gets very thick, almost like a callus on the skin, it's very difficult to treat that with any other methods. In that case, the two options we generally recommend is either having that little piece of nerve excised, having it surgically removed, in which case you will have some numbness on the two toes, but you take care of the pain. Another option to avoid surgery is doing injections of what's called denatured alcohol. And basically that kills the nerve. Now it takes multiple injections. It could be anywhere from 3 up to 10, but that will kill the nerve, stop the pain, still will give you the numbness in the toes, but you can do so without surgery. So for busy people who can't take time off and be laid up from surgery, this is a great option that works very well.